in this life.
Some continuity, you know? All right. So this is the format I will use for most of our lectures, almost all our lectures. We will use the systems and you will learn the terms associated with the system. So can someone share your screen with the, or you know what? Let me see if I can join the class with another device and then I will share my screen from that device. Let me see. Share screen, continue. Are you seeing my screen? I'm not seeing it. Are you seeing my screen? Oh, yes, that's my screen. Is it?
Yes,
Or
yes.
someone else? Is someone else is
Yes, it's
sharing?
visible. It's visible. The
Is it
cardiovascular system.
is it my screen or somebody else's?
I think it's mine. Let me take it off. Sorry.
Oh, no, no, no. Go ahead. It's okay. It's okay.
It's Lady Susan.
Leave
Okay.
it. Leave it. Okay, so I will leave with that device then. So go ahead. Thank you so much, Lady Sus. Listen, classmates, I hope you are showing your appreciation to your colleague. She is an exceptional, both of them are exceptional class monitors. I have had a very good experience with both of them so far, and it makes a big difference when your class is properly administrated, you know? Yeah. So please share, express your gratitude to them and make their job easy. Nobody's paying them for this work. So your thank yous should be great pay. All right. Okay, so today we are looking at the cardiovascular system, and our objectives are to name the parts of the cardiovascular system. So to the second slide, ladies. Name the parts of the cardiovascular system and discuss the function of each part. Define combining forms used in building words that relate to the cardiovascular system. You want to change your slide? Are you able to?
I don't know. It's like it's freezing.
It's
Oh
freezing.
man. Yes, man.
Hmm. Okay, so
Please, is it
you're going to
visible?
define. Yes, it is visible now.
Thank you.
So you have defined combining forms used in building words that relate to the cardiovascular system. You identify the meaning of related abbreviations and name the common diagnoses, diagnosis, clinical procedures, and laboratory tests used in treating the cardiovascular system. List and define the major pathological conditions of the cardiovascular system. Explain the meaning of surgical terms related to the cardiovascular system and recognize common pharmacological agents used in treating the cardiovascular system. Now we're looking at the structure and function. Stop. So, where the heart, when we think about the heart, what is the heart? Can someone read that? What is the heart? What the heart does? Go ahead. I'm going to invite you all to share in the reading. One person, read this slide, please.
Please, can I read?
Please go ahead.
Okay, so the heart pumps blood through the blood vessels to all body cells. It's covered by a protective sac called the pericardium, which is divided into two layers, the visceral and parietal pericardium. is divided into right and left sides by the septum. Each side consists of an atria and a ventricle.
Okay, before you move on, ladies, so the heart is the major pump in the body. Yes, this is, although we're using anatomy and physiology, it is not anatomy class. The goal is for you to learn the words. So when you look at this slide, you see what the heart does, right? So it pumps blood through the blood vessels. So if you write that, you write the heart, then you write what the heart does. Then you write the word pericardium, okay? What is the pericardium? It is the protective sac that covers the heart. And it is divided, pardon, somebody saying something? Hello? Okay, and there are two layers of the pericardium, right? Is that what it is saying? The pericardium has
Yes.
two layers. There is a visceral and a parietal pericardium. So you have a visceral pericardium, parietal pericardium, okay? And then the next new word that you have is the septum. What is the septum? It divides the heart into left and right. And then you have these chambers that are in the heart. Each one is called the atria and one the ventricle. So on both sides of the heart, you have an atria and a ventricle. Okay? So how many words you just learned? Several. So while you're in class, it would be a good idea to work on your what did I say you should make? Your own glossary. Okay? Is that a
Yeah.
good idea? Mm-hmm.
Very,
So
very, very.
write those words and know what they are, because they will come back. That's what you're learning in medical terminology. Okay? All right, next slide. Layers of the heart. Someone else read that for me, please. I'll take another reader. Ladies who, maybe you could help me to call the persons to read. I need everybody to be involved. So somebody else read, please.
Can I read, please?
Hello?
Yes,
Go right ahead.
Dr. Christiana.
Okay. So okay. Layers of the heart. Inside the pericardium, the heart has three layers of tissue. The first pericardium is the outermost layer. Second, myocardium, middle layer of muscular tissue, and endocardium, the inner layer.
And that is a diagram. Thank you very much. That is a diagram of the layers. The myocardium is very thick. Just note, it's a thick portion because the heart is a muscular organ. And then you have a thin lining on the outside. Remember, words are broken into parts. You have the, what did we say the three parts of words are? We have the, did we go through that slide? Yes, we did. The very first slide. Anyway, as we continue, we'll break them up. So we have endo, which is the first part of the word. What did we say the first part of the word is in medical terminology?
Prefix.
What is it? The prefix, yes. And the cardium, that is is the suffix, but it's also the root. So one says endo is inside. Epi means on top of, and myo means muscle, okay?
Yes, please.
And cardio means cardiac or heart. Okay, continuing, next slide, the heart chambers. Next person read, please.
Mr. Mevoji, are you there?
Please, I'm walking by the roadside, but let me get somewhere. Okay, let's go ahead.
Okay. Structure and function.
Okay, heart chambers. Right and left atria are the upper chambers of the heart. Right and left ventricles are the lower chambers of the heart. Fibers in the ventricles, Purkinje fibers, cause the ventricles to contract. Thank you.
Thank you, sir.
Continuing on the same slide, let me clarify. He said fibers of the ventricles. The pronunciation of that word, Purkinje, Purkinje fibers. Okay, those are
Thank
the nerve part of the nervous system that helps the blood vessel to contract. So blood flows through the heart in only one direction, regulated by what is called valves. So that's another word you need to make note of. The valves is what allow blood to flow in one direction. Continue. Next, continuing with structure and function. Next slide.
Structure and function. Arteries carry blood away from the heart. Veins carry blood toward the heart.
Thank you.
Thank you.
And just a clue, it's if you look at the arrow for arteries, it is red, and the one for veins, it is dark. So that is almost it's like a color clue. When blood is going away from the heart towards when it is traveling in the arteries, it is full of oxygen. And when it is going traveling in the veins, it is depleted of oxygen. So the colors is an indication, okay? And when you say arteries, look at the word away. Arteries takes you away. So AA, that's a clue to remember, okay? Next
Thank you
slide.
so much. Mr. Mevoche, you've done well. Let's call someone else. Madam Jemima, are you with us?
Yes, I am here.
Please, can you read this for us?
Okay. Structure and function. Coronary circulation. Circulation of blood within the heart muscle by the coronary arteries.
Which part is
Coronary
she
arteries.
reading? She's on the wrong
Coronary.
side. One moment. You went too far.
Y- Yes, I think this is
Okay,
it.
this one is
Number
it.
8. Yes, please.
This is the one.
Madam
Go ahead,
Jemima,
go
please go
on.
on.
Should I continue?
Yes,
Yes,
please.
please.
Okay. Valves of the heart. Atrial ventricular valves. Bicuspid valve. That is mitral. Then tricuspid valve. Then semilunar valves. Pulmonary valve. Aortic valve. This is cross-sectional top view of the heart. Control blood flow within the heart. Prevent the backflow of blood into the heart.
All right, thank you so much.
Thank
So we are
you.
talking about the valves in the heart. Look at the prefix arterial, okay? Arterioventricular valve, and two valves are described here. If you note, if you observe, one is bicuspid. That means it has two cusps. And one is tricuspid, tri and bi. One says two and tri says three, okay? So it has three cusps. And then the semilunar valves, the semilunar is like the moon. So it's like a part of the moon, okay? And you have two of the name is the pulmonary valve and the aortic valve, okay? All right, and they control the flow of blood in the heart and prevents backflow. That's what valves do. So their function, they control the flow of blood and prevent backflow. Next slide, next person.
Thank you. Mr. Harinyadi, are you with us? Madam Gladys Ankoma. Madam Gladys Ankoma. Madam Gladys Ankoma. Mr. Gabriel Akon.
Hello, Lady Zuzu.
Hello. Yes, sir.
Okay, I'm driving, so I'm parking and then reading.
Okay, that's fine. Then another person will read that when you're ready. Mr. Ericos, okay, Mr. Eric say, I don't know if you can be able to.
Please,
Mr.
can I read?
Emmanuel, yes, you can, if you're ready. Please go ahead.
The structure. Is it structure and function?
Yes, sir.
Okay. Coronary circulation. Coronary circulation of blood within the heart muscle by the coronary arteries. So we go to the table. Coronary arteries branch off the aorta, which is the largest artery in the body. Coronary arteries encircles the heart to supply the heart muscles with about 100 gallons of blood daily. The heart requires more oxygen than any other organ in the body except the brain.
Okay, thank you. So coronary, you had cardium that refers to the heart, but coronary also refers to the heart, okay? So this is circulation of blood within the heart by the coronary arteries. And the aorta is the largest artery in the body. It's that one that goes down from the head right down to where it bifurcates or separates. Bifurcate is a medical term. Bifurcate means it breaks. One thing breaks into two. So it breaks down the middle and one go to each leg. So the coronary, that's the aorta. And the coronary arteries encircle the heart to supply muscles. And how many blood goes through the heart per day? 100 gallons. And the heart requires more oxygen, a lot of oxygen, as well as the brain. Okay, next slide. So this is referring to pulmonary circulation. Go ahead.
Mr. Imanoba.
Good evening, everyone.
Good evening.
Good evening.
Hold on, something is blocking my screen. I'm going to use the next device.
Okay, please.
Structures and function. Remember, we're dealing with the heart. Pulmonary circulation. Circulation of blood between heart and the heart and lungs. Pulmonary arteries are only arteries to carry blood low in oxygen. Pulmonary veins are the only veins to carry oxygen-rich blood.
Thank you. So we're talking about pulmonary circulation. That means circulation that takes blood between the heart and the lungs. Okay? So if you look on the diagram, you will see the two shapes of almost like liver. That is the lungs. You can see where it has carbon dioxide at the top, oxygen at the bottom. Do you see that? Are you observing it? I hope everybody's looking at the diagram.
Yes.
Yes, please.
All right. And in the middle is the heart. Okay. And at the top, it is referring to the systemic capillaries. And, and it's basically giving you a description of how blood flows from the heart to the lungs and how it exchanges and what pulmonary arteries are. They are back on a couple slides back, slide 7, where you saw where it says arteries carries blood away from the heart, and the blood going away from the heart I mentioned is mostly oxygenated or oxygen rich blood. But in the pulmonary circulation, this is the only exception where there is an artery or two arteries that carries deoxygenated blood. So oxygen low blood is referred to as deoxygenated. D means no, right? When you say dysfunction, you would say or difficulty or much less than normal. But deoxygenated blood goes to the lungs. So that's the only artery, the only vessel that is an artery that carries deoxygenated blood or low blood. And by extension, the vein that is going back to the heart, it is the only vein, the pulmonary vein, the only vein that carries oxygenated blood. And why? Because the heart takes the blood, sends the blood to the lungs only to collect oxygen, goes into the lung, and it pulls in the oxygen, goes back to the heart, and then the heart. Look on the left side. Look on the left side of the heart. You will see the dark arrows, the dark vessel going towards the heart. Do you see it? Are you all seeing that
Yes.
arrow? Yes, it's
Yes.
going towards the heart, and you see it goes into the atrium, the top cavity is the atrium, and it goes down to the bottom. That is the ventricle, and its ventricle, it's actually shaped like a V. So that's a clue to remember it. The bottom part of the heart, and then it pumps it up to the pulmonary arteries that sends it to the lungs, and then it releases the carbon dioxide, takes up oxygen, and goes back to the heart. When it goes back to the heart, it goes into the aorta and the ventricle and pushes it to the rest of the body, pushes it to the head and to the system, to the intestines, everywhere, the liver, the legs, whatever, all the organs, kidneys. All right, next slide.
Thank you. What do? Usumano.
Okay, thank you. Function, structure and function. Systematic circulation. Flow of blood between the heart and cells of the entire body. Artery, arterial, capillary, venous, and vein. Blood travels through the body in a set as a result of heart contractions. Blood vessels become smaller in diameter as the blood leaves the heart. Remember, arteries leave the heart and veins return to the heart. Capillaries are the smallest blood vessels, and they serve as a transfer station between the arteries and then the vein.
Thank you.
Blood pressure.
Thank you. So, arteries are the big vessels that leave the heart, right? The aorta is the biggest one, and then it breaks down into smaller ones, become the arterioles, and then capillaries. When you cut your finger, if you use a knife and cut your finger, it's the capillaries that bleed that red blood. They're very tiny, almost microscopic sometimes. And then the venules are similar in size to the capillaries, and they take back the deoxygenated blood to the veins, which takes them back to the heart and empties them into the aorta. Next slide.
Thank you.
Next person.
Dr. Adjoa Ingrid. Dr. Adjoa Ingrid, are you here with us?
Oh yes, sorry, I didn't. I wasn't sure. Sorry about that. Can you hear me now?
Yes.
Okay. So, structures and function. Blood pressure measures the force of the blood surging against the walls of the arteries. Systole, contraction phase of the heart, and diastole, relaxation phase of the heart.
Thank you. Madam Donette.
Oh, sorry. So when you measure your blood pressure, I was talking, didn't realize I was muted. When you measure the blood pressure, the number that is at the top is systole. Easy way to remember is the higher letter in the alphabet. So S is the higher letter, okay? So you may see a question like a blood pressure, and which one is the systole, or which one is the diastole, right? So just note, diastole is the lower letter in the alphabet, so it's the lower number, the one under the bottom. No, is so? What am I saying? No, diastole. Oh, it's the reverse, the reverse. Systole is the number at the top, the number at the top. And the one at the bottom, it is the higher number, but it's the one at the bottom, okay? Got it?
Yes, please.
Yes. Okay, next slide.
Mr. Joseph Ajay Boateng, are you with us?
Yes, please.
Please go on, you're next.
Yeah.
Mr. Joseph, can you see the slide? Hello, sir.
Yeah, I can see.
Yeah.
It's gone. Yes, please. The slide is not on my phone. I have Madam Zuzu picture on my phone now.
Yeah. Oh, okay. Please, Honorable Collins, can you see the slide?
Yes, it's on it. The slide is not on my phone right
maybe
now.
I'm not seeing the slide. The slide.
We cannot see. That's where you must read from. The slide that you're seeing, Lady Zuzu.
You slide your screen.
Come again, Madam Donette.
But mine is not.
Yes, I'm saying, Sir Joseph, you can slide your screen. If you swipe, then you will see person's profile. But if you swipe again, swipe and you will see the screen.
I don't know what has happened.
I think when you have low network, it's like when your network is
Okay. Okay.
Dr. Pierre.
When the bandit is receiving it. So another person.
Dr. Pierre, please read this for us.
Hello. Yeah, I can hear it now.
We love your voice. Please read this for us.
Structures and functions. Conduction system. We have sinoatrial node, which is the pacemaker.
We have atraventricular node. Then we come to the bundle of His. Then we come to right and left bundle branches. Then we come to the G fibers.
Okay, so
then we go to conductive. Okay.
Thank you. So remember the principles that you were taught. Sinoatrial. Atrio is referring to the atrium. So that means it is between the atrium and the ventricle. So sometimes in medical terminology, the location of something will dictate the name of it. So atrioventricular node is between the atrium and the ventricles. And then they have the bundle of His. So you know it's a bundle. The right and left bundle branches, the branches that go off, and then the Purkinje fiber. Next slide. Okay. And that is really referring to the direction that the nerve will innervate the muscles. I would look for an appropriate video that demonstrates this conduction system of the heart and share it with you, okay?
Yes, please.
So it really, yes, it really just, it's the nervous systems, as it says conduction, you know, you're referring to electricity. So this is the nervous system activity that is being shown to you in the direction that the heart contracts and relaxes. So it starts at the top of the heart and it goes down to the bottom. Okay? Continue.
You. Mr. Joseph, are you ready? Mr. Joseph?
Yes, please. Yes, please.
Okay, please. Yes, sir. Please go ahead.
Yeah. Is for the structure and function. The structure and function. The heart, pacemaker. I want to enlarge it, but it has hiding. Yeah, pacemaker. Also,
Mr. Joseph, please, I think your network is not helping. Kindly mute yourself so that allow others to also come in. Thank you so much. Mr. Stephen Mate, are you with us?
Ladies,
Yes.
you need to be on slide 14.
Bibi.
Dr. Donna, please, this is 14.
Just 14?
Yes, please.
It seems something is wrong with my slide. Go ahead.
Yes, please. Dr. Stephen?
Yeah, lady.
Yes, please. Can you?
No, you're on 18. Go back up, please. Go back 2 more slides.
Okay, so we read this and read this.
No, something is missing from your slides.
From my slides? Okay, so I have a total of 20. Hey, it's a lot. I have a total of 50.
Right, we have 50 slides
here. Yes, yes, please. And
okay,
then,
so the slide that I have that is next is still referring to the conduction system. Yes, this one. This is the one we need to be on now.
Yes, please. Thank you.
Thank you.
Sir, please, you can read for us.
Can I go ahead? Yeah.
Yes, yes, please.
Okay. Conduction system. The factors infecting the heart rate. The physical activity emotion during one cardiac cycle, the heart contracts and relaxed. Cardiac cycle, one contraction plus one realization.
Thank you. Dr. Donette.
Oh, yes. So you know the factors that affects the heart, the health status. So there's so many factors that will affect your health. Like if you're hypertensive, your heart rate will be different, right? It will not be the same as a healthy person. If you have, I don't know, if you have kidney issues, if you have diabetes, if you're just generally unhealthy, then your heart rate will be different. If you have lung issues, your heart rate will be different. Kidney issues, all those things affects your heart. So your physical activity, there are some persons who are athletes, their heart pumps at a lower rate. So we may be taught that if you're athletic, no, we may be taught that our blood pressure, our normal heart rate would be, say, maybe 80 beats per minute, 80, 90 beats per minute. But you know, somebody who's athletic, an avid athlete, or someone who exercises a lot, so their body is accustomed to hard work, their resting heart rate could be as low as 60 or even 50 something. But for some persons, that is abnormal. But for an athlete, it is normal. So they have a very low resting heart rate because their body is accustomed to the high volume of pumping. Okay. And of course, your emotional state. That's all where Ingrid stated if you're obese. Yes, because the body has to work harder. And your emotional state. So if you are going through emotional stress, if you are frightened, if you're anxious, if you're afraid, all those emotions will cause your blood pressure and your heart to be at an abnormal rate. So just your stress level, you know? So if you are laying down in your bed, but you are stressed out about something, your brain is just going, something is disturbing you. Yes, your electrical activity of your brain is gonna do something else outside of the norm. Next slide. And you don't have to say structure and function. We know we're going through structure and function, so just read the rest of the slide.
Thank you. Madam Dr. Sassana.
Okay.
Yes, please.
Fetal circulations. I'm going to mention the diagram words.
Structures to the fetus.
Yes,
on the right side. On the right side.
Let's see. Okay.
Hello. Should I read?
Hi.
Hello.
Structure.
I'm saying that I'm going to, okay, structure unit. Structure unique to the fetus. Foramen over and over. And Datus arteriosus. Yes, about datus venosus. Note the umbilical cord contain 2 arteries and 1 vein.
Thank you.
Okay, thank you very much. This is referring to the circulation that takes place when a woman is pregnant. So at the bottom, you will see the placenta. When a woman is pregnant, there is a whole new circulatory system that develops to accommodate nourishing the baby. Okay, so there are three structures that were mentioned. It is foramen. You can see the word amen. Foramen ovale. Ductus arteriosus. Ductus venosus. So those are the vessels that are unique to the fetal circulation, and that is a part of the umbilical cord, right? And when the baby is delivered and mother no longer has the placenta attached to her body, then this circulatory system no longer exists. So it is directly, if you look at the diagram, you can see that the big red cord is connected directly to the liver. So the baby's circulation goes into goes to that organ, and you can see also the ductus arteriosus. You see both of them going where there's a Y, like an upside down Y. Okay, and so one is the vein, one is the arterios, or one is the ductus arteriosus, the one that carries blood away from the heart, and ductus venosus, that carries the deoxygenated blood back to the mother. Okay, let's go to the next slide, combining forms and abbreviations.
Dr. Kelvin Frimpong, are you with us? Dr. Kelvin Frimpong. Dr. Manu Charles, are you with us? Dr. Yakubu, are you with us?
Yes,
Okay.
please.
Thank you so much.
Can
Please
I
go
read
ahead.
now?
Yes,
Hello?
please go ahead. Please go ahead. Thank you.
Combining form and meanings. Angie, with the arrow goes to blood vessels. Atro, aorta, arteries, artery, aorta, fatty matter.
You can stop there. Thank you.
Okay. Thank you, madam.
Okay, so angio is referring to the blood vessels, okay?
Yes, please.
And it's self-explanatory. Aorta. Someone is saying something?
Dr. Charles, your network is not too clear, please. Kindly mute for now.
Okay, we'll allow someone else to finish it. We'll allow someone else to finish this slide.
Yes, Dr. Charles, can you hear? He was trying to speak, but... Hello, I think your network is not helping.
I can continue. I can continue.
Please go ahead.
So
Thank you.
Artery, atrium, cardi, heart, hemangi, blood vessel.
Thank you. And you see atri, remember atrioventricular? You remember that?
Dr. Charles, please, so sorry, your network is not too clear. So please, for now, if you could mute. Thank you.
So this is basically showing us how a piece of a word And with the O on it, it is the combining form, so it allows you to attach one word or one meaning to another meaning to create the medical term, okay? So don't be confused by it. Once you see the O, it means it is combining two different things. Atrioventricular. I did highlight that word. Cardiomyopathy. So, right. So this is basically showing you a part of a word and it has a meaning. So when you attach that meaning to another meaning, then you create the medical terms. Continuing, next slide, please.
No, can I come in?
Pericardy, starting with pericardy.
Yes, Dr. Donna, please, Dr. Christiana wanted to say something.
Yes, I'm hearing.
Yes,
Go ahead.
Can you please go over the explanation regarding the O?
The O. Note we are doing combining forms. So we are looking at how the medical terminologies are developed and how they are combined to create medical terms. So continuing on this same slide that we are on pericardy, because it's the same thing, combining forms. So you may have pericardy for pericardium, but you had other O, right? So it may be phlebotomy, right? Phlebitis, but they put the O there or another vowel that will help you to join this meaning to another meaning. So phleb, look at the second one, phleb. Are you seeing it? PHLEB. You see that?
Yes, please.
Yes, please.
Right. So phleb means vein, but it may be attached to a word otomy, which is to dissect, or they would insert a needle into the vein to take blood out. So you may be phlebotomy. You understand? So
yes, please.
Tommy is to dissect. It could be itis. So that's a I now being attached to itis, right? Phlebitis. It is the vein which is inflamed or inflamed. Okay? So this may be a part of the medical terms which is attached to another thing, and they will use a vowel as a joining letter.
Thank you very much.
But we are giving you these shortened terms with their meaning. So I won't test you on every single one, but you need to be familiar with them because this is going to be a part of your exam. Okay? But I will not test you on every single one, but you need to make sure you are learning them. Okay?
Yes, please.
Hello, madam.
Continue. Go ahead.
Yes. So I want to understand this. Vaso means blood vessel. So when we add
That's right.
when we add vasoconstriction, does it also mean blood vessels?
Vaso means blood vessel constricting, yes, or contracting. Constriction means contracting, and vaso means blood vessel constricting.
Okay.
Or contracting.
Okay.
Or it could be vasodilation. Vaso is still blood vessel, but it is dilating. That means it is relaxing or getting bigger. Okay. So someone go through all these letters, please. Waiting.
Yes, please.
Go ahead.
Please, should I mention the beginning of this or I should continue?
Please, continue. Read what is there.
Okay.
The abbreviation and the meaning.
ACG.
Before you go back, before you continue,
Yes.
Lady Zuzu, the slide with the ECG, there's a slide, the first one that you had put up, it came up at slide 14, conduction system.
Yes, please.
Oh, I'm sorry.
Which one?
I am the one who
Okay.
had the wrong, it looks like my slide rearranged.
Oh, sorry.
Yes, that's what happened. My slide rearranged. So you are
Sorry.
right. This picture was supposed to be in another location.
Yes,
Go
please.
ahead. Go ahead.
Yes. Okay.
Go ahead.
Madam Yakubu.
The reader.
Dr. Yakubu, please go on. Dr. Yakubu, are you with us? Okay, so Dr. Yakubu, Dr. Jehoshaphat Donyo, please, are you with us?
Yeah.
Thank you so
Thank you.
much. Thank you, sir.
Welcome. Please. Okay, thank you. ACG, accelerator globulin. AF,
One
atra.
moment. Hold on.
Okay.
Let's go back to
Thank
the
you.
first meaning. It says accelerator. Accelerator. Globulin. Globulin. Say that.
Globulin.
Globulin, that's right.
Globulin.
Okay, go ahead.
AF, atrial fibrillation.
Fibrillation.
Yeah.
Fibrillation. I want you to say it.
Vibration.
No, look at the word. Fibrillation. F-I.
Fibrillation.
Right.
Fibrillation.
Mm-hmm.
Please repeat it, sir.
AF, atrial fibrillation.
Good.
Okay, and I know I understand the language barrier, hence the reason we have this course, right? It's atrial fibrillation.
Atrial fibrillation.
Yes. Say it for me. Atrial
fibrillation.
Okay, thank you. Yes. Continue now. AS.
Aortic atonosis.
Okay, I'm gonna stop you again. Aortic stenosis. Aortic. So this is referring to the aorta, which is that big blood vessel I told you about in the back of the body. It goes in line with your spinal column. It's that big blood vessel. It's called the aorta. And this is referring to aortic, the same thing, aortic stenosis. That means a narrowing, a portion of it gets narrow. So I want you to say it. Aortic stenosis.
Aortic stenosis.
Yes.
Sir, please say it. Let us all say it so that we know how to pronounce it.
Aortic stenosis.
Aortic stenosis.
Yes.
Aortic stenosis. Aortic stenosis.
Beautiful. So guess what, class?
Aortic stenosis.
Yes, when you get to your final year in college, in this college, you will go into the hospital, right? And some of you You may not feel so now, but some of you will become famous. You will be invited to speak on television, on the radio, and you will have a wide audience. And people will be listening to you, including medical doctors, right? And so you want to get it. And you will go into the hospitals in your final year, and you will join the ward rounds, and you will interact with doctors and nurses. And when they speak, you need to understand what they're saying. And when it's your turn to speak, you need to speak in a way that you are understood. Hence the reason you're learning this language. So it's important to practice and to make every effort to get it. Because some naturopaths or some herbalists become famous, and then they go on TV and they're talking and they say foolishness, and people look at them and mock them. And you are very confident, and you are speaking, and you think what you're saying is right, and people are laughing at you, right? So please, I encourage you all. You will become popular because you know the herb, and you do things that help the patients, and the patients will make you famous, and then people will say, oh, this doctor is doing great work, so I want to interview them. And then you go and you talk about the patient's kidney that is in their chest or in their thorax, right? So learn your anatomy well, learn your words well, so that you do not become a laughing stock, right? The public who don't know the words will not know the difference. But remember, there are medical practitioners who are listening, and you will lose credibility if you don't learn right, okay? So practice when you hear the word. Yes. Yes,
Dr. Daniel.
Arteriosclerotic. That's right. You can continue reading.
Yes. Dr. Daniel, please go on.
Oh, is the microphone on?
Yes, it's on. Please continue.
You're doing very well.
Please continue. Let us learn.
So, what should I do?
Continue. ASCVD, arteriosclerotic.
Oh, okay, it's okay. Oh, it's gone. Oh, okay.
It's gone.
It's arteriosclerotic.
Yes, it's ASHD, arteriosclerotic heart disease.
Cardiovascular.
Arteriosclerotic
Arteriosclerotic
cardiovascular disease.
That's heart disease.
Arteriosclerotic.
ASPVD. Okay.
Can I try?
Cardiovascular disease.
Yes, please try.
Atherosclerosis, cardiovascular disease.
Actually, I was mentioning
Atherosclerotic cardiovascular.
No, break it up.
Cardiovascular disease.
Listen to me. Let me say it. Arteriosclerotic. Sclerotic. Arteriosclerotic.
Arteriosclerotic.
Arteriosclerotic cardiovascular disease.
All right.
Let's move on.
Good.
Arteriosclerotic
All right. Next
Arteriosclerotic
one.
cardiovascular
Next
disease.
one now. ASHD.
Arteriosclerotic heart
Next one now.
disease.
All right, class, thank you so much. Dr. Donnet is asking us to go to the next one.
Yes,
The next one.
atrial septal defects.
That's ASD.
Atrial septal defects.
Yes, good. Next one. That is ASD now. ASD is atrial septal defect. Yes.
Arteriosclerotic heart disease.
Yes. AV.
Atrioventricular.
That's right. You know that one already. All right. Beautiful. Continuing with the abbreviations. So when you look at medical records, or you may see on your lab results, you will see the shortenings. And unless you understand what it means, it will be a little challenging. So try your best to learn these as best as possible. Next. Yes. BP.
Madam Kate Aiko, are you here with us? Madam Kate Yabua.
Kate Aiko is here, but my screen,
Madam
the
Kate.
slide is not showing on my screen, please.
Show it.
I can do
Can you
this,
slide
please.
Yes, please.
I can do this, please.
Please go
BP,
ahead.
blood pressure. BP, blood pressure. CABG, coronary artery bypass graft.
Okay, so they may call this cabbage. It may be referred to as cabbage in the hospital.
Okay.
If you hear a medical practitioner says cabbage, this is what they're referring to, and it's coronary artery bypass graft.
Okay, that is cabbage.
Yes.
Okay. CAD, coronary artery disease. Cataract.
Catheter. Say that, please. Yes.
Okay.
Catheter.
Catheter, the one they insert at the V.
That's right.
Right?
Yes.
CCU, coronary care unit. CCU, coronary care unit. CHD, coronary heart disease. CHF, congestive heart failure.
Thank
Am
you.
I right, madam? Thank you.
Thank
madam.
you. Perfect.
Thank you so much. Please, who volunteered to read next?
We'll have two students sharing this slide. One do the first three.
Ready. This is Charles, man.
Oh, Mr. Charles, your network is back. Please go ahead.
Okay. Planning forms and abbreviations. That is CO. Cardiac output. CPK.
CO, cardiac output.
CPK. Creatine phosphokinase.
Okay, this is referring to one moment before you continue. So CPK, you will see this with kidney patients. It's creatinine. Say that, creatinine.
Creatinine.
Oh no, it's creatine. Sorry, this is creatine. And the next word is phosphokinase. Phosphokinase.
Phosphokinase.
Yes, phosphokinase. Creatine phosphokinase.
Thoracic posture.
Chinese.
Okay, continue. CPR.
CPR. Your pulmonary CPR. Pulmonary resuscitation.
Amen.
CVA.
And you all will do.
For
Thank
that I
you.
know.
Cardiovascular.
Yes, you all should be doing your CPR training soon. Okay. I'm sure you will be. They will make the arrangements and you do your CPR training. So all of you will know.
CVA.
You've done it before.
Next
You're already
person.
done with it.
Next
Dr. Charles.
person, please.
Thank you so much.
CVA.
Cardiopulmonary.
CVA. Cerebrovascular accident. CVD. Cardiovascular disease. DSA. Digital subtraction angiography. DVT. Deep venous thrombosis.
Thank you.
Thank you. Thank you so much.
Next person.
Mr. Kwame Okra here with us. Nana Anso Andane Adaruma, are you here with us?
Yeah, diagnostic, procedure, and laboratory tests. Cardiology is the treatment of cardiovascular diseases, and the physician who specializes in heart conditions is called a cardiologist. Auscultation may reveal the following abnormal heart sounds: murmur, bruit, gallop.
Okay, thank you. For bruit, the T is silent. So imagine you're saying B-R-U-I, bruit. Okay?
So it's bruit. Okay.
Yes. So auscultation is referring to listening, right? So that's what the doctor does when they are listening to sounds with the stethoscope. So that is auscultation.
Thank you.
Okay, next slide.
Next slide. Mr. Ambrose, Helen Hans, please, are you here with us?
Yes, please.
Please go ahead and read for us.
Okay.
Common diagnostic test.
Okay, so you okay. I thought I was reading the other one. Okay, so exercise tolerance test. That is the ETT. Patients exercise on a treadmill, and the technician monitors the heart rate and respiratory rates. Electrocardiography is so this is an electrocardiogram which measures the amount of electricity that flows through the heart. Electrodes placed on the skin at specific points detect the heart's electrical impulses.
Thank you.
Very good. Thank you. Next slide, next person.
Yes, please. Any volunteer? Madam Vivianipa.
Please, I
So
can't
please
see
note these
anything.
words, these definitions you're seeing here, you may see them
Yes,
in.
please. Can I come in?
Lady Zoo, please, I can't see.
Can see. Oh.
Hey, man.
Please, who else can
Lady
see?
Zuzu.
Can I read?
Yes, please.
Can I come in?
Yes, please. Please come in so that my sister looks for it. Thank you.
Test involving X-rays, angiocardiogram, injection of a dye followed by X-ray of the heart and the heart's large blood vessels. Other tests angiogram, arteriogram, aortogram, venogram, in bracket, pleurogram, then ventriculogram. That's a move. Ventriculogram, yeah.
Thank you, sir.
Please note that the definitions that refers to X-ray, all of them ends with gram. Okay.
Yes, please.
Next slide.
Mr. Peter Mposa.
Yeah. I just read this.
You just read.
No, let me read it. Yeah. Well, I can.
Can I read? Ultrasound tests produce images by using sound waves. Doppler ultrasound measures blood flow in certain blood vessels. Echocardiography records sound waves to show the structure and movement of the heart.
Thank you. Madam Ama Ado, please, are you with us?
I am Harry. My phone, I'm Harry.
Okay, Mr. Harry.
My phone is off, so I'm using different phone.
Yes, please. Please.
Harry? Yeah.
Yes, please.
Okay.
Thank you.
Okay, read.
Yes, please.
Okay. Diagnostic, procedural, and laboratory tests. Other non-invasive tests. Cardiac scan. Positron emission tomography, PET. Multiple gated acquisition, MUGA. Angiography. Magnetic resonance imaging, MRI. Other procedures requires insertion of an actual device such as a catheter into a vein or artery, and the device is guided to the heart, as with cardiac catheterizations. Thank you.
Thank you, sir.
Thank you. Next slide.
Okay. Blessing Kumar. Blessing Kumar, please, are you with us? BMS Holistic, please, are you with us?
Diagnostic procedure and laboratory tests. Laboratory tests. Flow of blood in the country is affected by the amount of cholesterol and triglycerides contained in the blood. High density. Now, let me start. HDL. High density lipoprotein actually remove lipid from the fishes. The protein and to form blood trees.
Okay, I think the internet is not great, so let me just read high density. Lipoprotein actually removes lipids from the arteries and protects from the formation of blockages, and low density lipoprotein and very low density lipoproteins causes the cholesterol to form blockages in the arteries. Next slide.
Mr. Dick,
So those are what they refer to as LDL or HDL. They would often say the HDL is good. And they would say that you would hear people refer to as the good cholesterol and the low cholesterol. The good cholesterol and the bad cholesterol.
Thank you. Mr. Blessing Kwesi, can you please mute your mic? Thank you so much. So, Donets TV, please, are you with us?
Yes, I'm with you.
Thank you so much. Can you read this for us?
Yes, I will. Diagnostic, procedural, and laboratory tests. Laboratory tests also help to diagnose myocardial infarction. Troponin T and troponin I are proteins found in the heart, and tests for these can diagnose a myocardial infarction faster than most other lab tests. Cardiac enzymes, also called serum enzyme tests, measure the amount of enzymes released into the blood by the damaged heart muscle during a myocardial infarction. CPK, creatine phosphokinase, LDH, lactate dehydrogenase, and GOT, glutamic oxaloacetic transaminase.
Okay, so let me help you with those. They're all tongue twisters. So infarction, the myocardial is not infarction, it's infarct. F-A-R-C. So infarction, and that is when the heart is getting very minimal nutrient blood supply, and the heart, think of it as if it is breaking. So the tissue will start, to become damaged. So myocardial infarction, that's when people feel pain. That's when they get the pain in the chest. And then the CPK is creatine phosphokinase. Repeat after me. You don't have to open your mics, just practice. Creatinine phosphokinase. You might curse a bad word. You might curse a bad word in your language. Creatinine phosphokinase. LDH, lactate imagine you're saying dehydration, but it's dehydrogenase. Dehydrogenase, lactate dehydrogenase. Practice saying it, please. Lactate dehydrogenase. Then glutamic oxaloacetic, look at it, oxaloacetic, glutamic oxaloacetic, transaminase. Amine. Anybody ever hear about the word amino acid? Transaminase. So amino acid is in that word. Trans is when you think about transgender, transaminase. So the words, the breaking of the words, remember the prefix, the suffix, the root word. So transaminase, they're all saying something. Remember, some people may not have been here when I started the class. I'm encouraging everybody, when you meet the new words, create your own dictionary or a glossary. You meet a new word, don't just say you heard it so you know it. When you write, when you use your hand to write, and I would encourage you, rather than type it, use your hand to write it. Because if you are familiar with let me tell you, what's that field of when you study brain? What is it? Neuroscience. Yes, if you understand the neuroscience, Your brain is constantly evolving. When you just think something, it may create only one pathway, but you think, you say it, you write it. That is 3 different pathways that your brain creates. So when you think about something, you see it, you write it, you say it. That is 4 different pathways that your brain registers it. So that is the value of making very good notes. When you hear something, you see it, you write it, and if you are able to draw a picture of it, then your brain remembers it more. So practice writing your own glossary. That way, it is more likely that you will remember it. Your brain is challenged to use several approaches to learn it. So you will hear me say it, you will see it on the slide, but then you need to say it, and then you need to read it, and then you need to write it. And that guarantees that you will more likely remember it. And one of the things I've noticed for myself, when I go to lectures, I learn from my teachers and it is fun. I hear my classmates. But you see, when I go home and I sit down with my notebook, and I take notes in class, you know, but then when you go home and you take your notebooks and you make your own notes, make beautiful notes, do your extra research and write your notes. And you see, when you do that, you actually, I almost feel sad, because when I do that, I don't have to study it again. I know it, right? You can go into the exam and write the exam without going to study again. If you make the effort after class, sit down. While you're in class, make notes. When class is finished, sit down again and make your own notes. That guarantees you that you will learn the information. So I know we are online, I'm not in front of you, and it is very easy to just sit, because I sent you the information, to just sit and say, okay, I have it. Some people may say, I don't even need to come to class because I have the information. But you need to interact with the information to get it into your head. So if you become a very active learner, and that's part of the reason I'm trying to get you all to speak in class, that is just one way that will enhance your learning. You now need to go and make your notes. When you make those notes, I guarantee you, any question I come with, you will know it, because you would have gone through it. And if you don't, I won't give you anything that I did not teach you. Everything you will get in my exam is what we would have done. But I'm encouraging you, practice to make your own glossary. Don't just depend on the slides, okay? All right, great. Next slide.
Thank
You're
you.
at 29.
Madam Verosai. Mr. Solomon Niajete. Mr. Solomon, are you with us?
Yes, please, I'm waiting, but I find it difficult to get the slide. Most of the time I see your face, the slide will come one, then your face. I think my network is very slow.
Yes, please, that's fine. Okay, that's fine. Kindly mute so that the next person can help read. Thank you so much.
Can I try?
Yes, please.
Okay. Now we have pathology. Then we are talking of the risk factors of developing cardiovascular disease. That's CVD. So we have smoking, lack of exercise. Then we have heart rate, abnormal rhythm are called arrhythmias.
Arrhythmias. Look at the word. two R's, arrhythmias. Arrhythmias.
Yes. Okay. That is, we have bradycardia. We also have cardia. Then we have atrial fibrillation. Atrial fibrillation.
Atrial fibrillation.
Fibrillation. Okay, yes. Hey, it's gone, ladies. Chair is here. Okay, it has come back. It has come back. That we also have Sudan. We have Mama. Then we have Galo. Then we also have premature atrial contraction, premature atrial contraction. That is PAC. Then we have premature ventricular contraction. That is TVC. Thank you.
Thank you so much.
Okay, so the next readers who are coming on, you don't need to repeat the title once it is stated already to save on time. And you don't need to say, then we have, okay? You just do what is there, because I will need to take over soon so that we get through the slides. We are just over halfway. Okay, continue.
Thank you. Mr. Harry, you want to say something? Dr. Daniel, can you mute your mic, please?
Yeah, please.
Our Ado.
Yes, I'm Harry. I am Harry. I'm using different phone, please. My phone is off. It's down now.
Okay.
My question is, when you look at the cardiac VVV, sometimes V is added on the abbreviation. Sometimes V is not added. V is in the middle part, and then it is not included. So how CVA and those things? How will I know that the V is not vascular?
Sometimes repeat your question.
What I'm saying is that sometimes V is vascular when you talk about cardiovascular. And then sometimes to some of the words to the cardiovascular, V is not standing alone as it is. It is added to cardiac and cardio. So in this case, in case it comes maybe exams, or I think the hospital.
Dr. Kumsin, please kindly mute your mic.
Your mic.
Dr. Kumsin, thank you so much.
Wow.
Please come again, Mr.
Can you
Harris, so that
repeat?
Dr. Donek
There was some disturbance. Yes.
Please come again. Mr. Harry? Mr. Harry, please come again.
I hope please you've understood.
It wasn't. No, please. She said you should come again.
What I'm saying is that all the abbreviations that we have learned, some of the V abbreviations are standing alone. Some too, the V is added.
Give me the examples you're referring to. Can
yes,
you give me the examples?
Okay. It seems. Oh, it's gone.
Go back. I think she's talking about the cardiovascular disease.
And then how will I know that? Sometimes
contraction.
Yes. So sometimes in the abbreviation, V is standing alone. But sometimes in the abbreviation, the V is a different name. Different name from vascular or cardiovascular. Sometimes cardiovascular has been put together. So you not see the V in it. But in other case too, you see the V inside the abbreviation as vascular, then something. And I'm asking that how will I be able to identify that the V is sometimes called vascular and sometimes the V is standing for a different abbreviation? That's what I'm asking.
Okay, so
right?
if I had the example you're referring to, then I could speak specifically to that.
Okay,
But
it seems I'm getting.
yeah.
I
So
appreciate
in the
it.
instance
Go
when you
for it.
see that difference, hello, somebody saying
Yeah.
something?
Please, you said I
Hello.
should go
You
where?
can spell it. Please, you go for it. Please go.
To which of the slides?
Go one more step. Look,
Okay,
the very slide before this one that you're showing.
okay.
The very slide before this one. Which
Is it this one?
say that there is factors in developing cardiovascular disease.
Can I say something about the bee, please? I would want to believe that the bee would be whatever you're dealing with at the time. Then of course, if you're thinking about vein or the heart, then you would have known that it would be vascular. If you're dealing about talking about something else, if you're doing the testing something else, then you know that it will be specific to the area. So that is my belief.
You want him to show me the specific word he's asking the question about. Yeah. And you know, the reality is we are doing medical terminology, which is a universal medical language across borders, because CVA, cardiovascular accident, is the same thing in Ghana, Jamaica, in Spain, as long as you're speaking in English. But you know, in Spanish, they use a different, they will have different abbreviations in Spanish, but we are speaking in the English context. So you have to remember that there are variations depending on jurisdictions that you are in. And as your colleague just tried to clarify, it depends on the context and what you're dealing with. So if you have questions, don't just operate in isolation and say, oh, well, I don't know, and they're so confusing. Just ask somebody, and I'm sure you will get some clarification. So there are variations. Don't think that everything is cast in concrete. That means it's immovable forever and ever. Amen. Just know that you are in a dynamic space, and there are variations from time to time and from different, and it varies from across specialty, because sometimes referring to the heart will not always be cardiac, right? It can be there is another term for cardiac. I'm trying to remember now. There are more than one terms that is used for the heart. You know, so you may be referring to the heart, but there are two different abbreviations. So it depends on the context and the jurisdiction. So just ask questions, you know? Yeah.
Thank you so much. Dr. Daniel Kumsen, could you please mute your mic? Thank you so much.
Okay.
So the next slide is pathology. Blood pressure abnormalities can damage the heart and other body systems. Hypertension, into brackets, too high. Hypotension, too low. Now in the box, we have essential hypertension occurs without any specific cause. And then we have secondary hypertension has a known cause. For example, high salt intake.
Okay, thank you. And please note the prefix hyper and hypo. Hypo refers to low, hyper refers to high. So in whatever context, when you see hyper, it is saying something is high or too high. Okay. Next slide.
Yes, please. So we have a lot of things which has been circled here. We have plaque, we have atheroma, plaque. We have atheroma, We have thrombus, diseases of the blood vessels.
So all of these are diseases of the blood. All of them in the circle, they are all diseases of the blood.
So we have varicose veins, we have phlebitis, and embolus. Dr. Daniel Kunsin, your mic is really disturbing us.
So what I'll encourage everybody to do, write down all of these words and find the meanings of them. Okay?
Yes, please. Thank you so much.
Mm-hmm.
So the next slide. Coronary artery disease refers to any condition that reduces the nourishment the heart receives from the blood flowing through the arteries of the heart, such as aortic stenosis, angina pectoris,
angina
pectoris, coarctation of the coarctation of the aorta, pulmonary artery stenosis.
Mm-hmm. And I'll say it again, write down the words and find the meanings, okay?
Yes, please. General heart and lung diseases, myocardial infarction, disruption of blood flow to the heart muscle, also called heart attack.
And you may hear somebody say, you may also hear a physician say the patient infarct. And it's basically saying they had an infarction, a disruption in the blood flow. They may have an infarction at any part of the body. It's just that we're doing the cardiovascular system today. There can be infarction in the kidneys, in the brain, right? In the lungs, anywhere in your body you can have an infarction. But we are looking at myocardial infarction today. So infarction is disruption of blood flow. Okay?
Yes, please.
Okay.
And then we have cardiac arrest, also known as asystole.
Asystole.
Asystole is the sudden stopping of the heart. Asystole is the sudden.
A means absent. A means absent. Remember, systole means the contraction. So A is absent, systole. So no contraction.
Asystole is the sudden stopping of the heart. Congestive heart failure occurs when the heart is unable to pump the necessary amount of blood.
Mm-hmm.
Specific inflammatory conditions of the heart. Endocarditis.
Lady Zuzu, one question. You've exhausted your list of your schoolmates?
So I can get, I think, Dr. Philip Nebe.
Can I read? Yes, I can read. This is Dr. Philip.
Yes, Dr. Philip, please go ahead. Emmanuel Kwesitete, kindly mute your mic, please.
Specific inflammatory conditions of the heart. Endocarditis, myocarditis, cardiomyopathy, bacterial endocarditis, pericarditis, and intracardiac tumor.
Intracardiac tumor. And note the itis at the end of each word. Wherever you see those itis, it means inflammation. Okay? So the endo is telling you where. Myo is telling you which part of the heart. Okay. And yes, and peri, myo, endo. Remember the lining of the heart. You have the the pericardium, myocardium, endocardium. So these are different parts of the linings of the heart that are inflamed. Okay, itis always means inflammation. Okay.
Thank you so
Next.
much. Dr. Meshach, please, are you with us?
Yes, please. Yes, please, I'm here.
Yes, sir. Can you go ahead? Dr. Meshach. Dr. Meshach, are you with us?
Yes. Oh, okay. I muted myself. I was reading.
Oh, sorry.
Okay. So, patent congenital heart conditions, patent ductus arteriosus, septal defect, tetralogy of Fallot, valve conditions, aortic regurgitation, mitral insufficiency, mitral valve prolapse, tricuspid stenosis, valvulitis, rheumatic heart disease.
Please finish this one.
Surgical terms. The goal of most cardiovascular surgery is to improve blood flow to all body cells.
Please, this is the last one.
Surgical terms. The cutaneous transluminal coronary angioplasty (PTCA) is a surgical procedure in which a balloon catheter is inserted into a blocked blood vessel to increase the blood flow of that vessel. Picture reading: narrowed artery with balloon catheter positioned. Inflated balloon presses against arterial wall.
Okay, so you will note the balloon that is deflated. It is placed where there is almost a blockage, and the balloon is basically opening up the blood vessel so that blood can flow through. Surgical terms, continuing.
Dr. Meshach, last one.
Okay. It hasn't shown, please. Cardiac catheterization is the most common type of operation performed in the United States. Other procedures involving catheters: balloon valvuloplasty, used to open narrowed cardiac valve openings; coronary angioplasty, used to open a blood vessel; angioscopy, uses a fiber optic catheter to view the interior of a blood vessel. Thank you.
Thank you.
Thank you so much.
Surgical terms, continuing.
Some conditions require the creation of a bypass around blockages. Coronary bypass surgery. A vein from another part of the body is often used as a graft to bypass an anterior blockage. Saphenous vein and the mammary arteries are commonly used as grafts for the procedure. Fontaine's operation creates a bypass from the right atrium to the main pulmonary artery.
Thank you so much, Dr. Meshach.
Okay, thank you. After Dr. Misha, then I will finish up.
Yes. Dr. Bennett, please.
Okay. So surgical terms continuing. Surgical removal and replacement procedures include heart transplant, thrombectomy. Thrombectomy means removal of the thrombi. If there's a clot in the foot, deep vein thrombosis. So thrombectomy refers to removal of that clot. Embolectomy, an emboli is referring to air. So if there's air in the vein, sometimes people would get an intravenous infusion, or there may be a fracture and there's a blood vessel that is torn, then air can get in. There can be an emboli, but there can be fat, there can be bone, there can be air, right? An emboli. That's a foreign thing in a blood vessel. So that's ectomy. Ectomy means removal, a surgical removal. So you have thrombectomy, embolectomy, atherectomy, that is a removal of an artery, valve replacement, and endarterectomy, arteriorectomy, or that is you have atherectomy and arteriorectomy, valvoectomy, and venectomy, venipuncture. That is when you puncture the vein. Then surgical reconstruction and repair procedure, you have valvoplasty, so that is repair. And then we have the removal and replacement that we mentioned at the top. This is plasty is repair. Anastomosis is joining together. Okay. Next slide. Pharmacology in cardiovascular conditions. So drug therapies for the cardiovascular system generally treats the following conditions: and angina, heart attack, high blood pressure, high cholesterol, congestive heart failure, rhythm disorder, vascular problems. Next slide, please. Anti-anginals, these are for pain, when people have hard pain. So relieve pain and prevent attacks of angina. So 3 categories of these drugs. There are nitrates, which are nitroglycerin. Then you have beta blockers like atenolol. And then you have calcium channel blockers, example nifedipine. There are several examples of these kinds of drugs, but these are the broad categories that they use in treating angina. Then we have the high blood pressure, may require treatment with 1 or more drugs, and these are some of them. Next slide. Medications for hypertension are vasodilators, diuretics, angiotensin converting enzymes, or they would call them ACE inhibitors. Next one, congestive heart failure is treated with medications that increase myocardial contractions. So the patient heart does not function well, so they will get a medication to strengthen the heart contraction. In certain situations, the blood vessels may need to be narrowed as well. And some of these medications are ACE inhibitors, which are used in blood pressure treatment, diuretics, cardiotonics to give some tone to the heart, vasoconstrictors. Rhythm disorder, next slide, are treated with medications that normalizes the heart rate by affecting the nervous system that controls the heart. And some of these are beta blockers or calcium channel blockers. And continuing pharmacology, other medications like lipid-lowering drugs helps the body excrete unwanted cholesterol. Anticoagulants and antiplatelet medications inhibit the ability of the blood to clot. An example of those, some of you might know heparin or warfarin. And in our context as naturopaths, you may know of garlic as a great anticoagulant. Garlic ginger, turmeric, all of those are anticoagulants. Medications used for vascular problems may include drugs that disease the thickness, that decrease the thickness of the blood, or drugs that increase the amount of blood in the heart that the heart is able to pump. All right. So, lady, you can turn off that. Don't show that slide. Lady Zuzu? All right. So all arteries except one carries oxygenated blood. And all veins except one carries deoxygenated blood. Who remembers what that is? We spoke about it. Who remembers? Someone tell me the only artery in the body that carries deoxygenated blood. What is it?
The pulmonary, I think it's
Pulmonary artery. Arteries always carries blood away. Okay? And it almost always carries oxygenated blood, but this one artery in the body carries deoxygenated blood. It is, you are correct, the pulmonary artery. And the one that carries, the only vein that carries oxygenated blood is
Pulmonary vein.
Amen. Oh, you all are so smart. Yes, you all get an A. All right, the next question. The fetal circulation blood flows from the right atrium through the foramen ovale into the left atrium. What would happen if the foramen ovale remains open permanently after birth? What do you think would happen if the mother's circulation did not go back to its normal circulation and the baby's circulation remained in the mother? I guess we didn't have time to break down the fetal circulation, so I won't worry your head with that one. All right, one other question. Okay, now that's too much anatomy. I won't ask you that. Okay, let me see. Who remembers what CPR means? What is CPR?
cardiac pulmonary resuscitation.
Say it again.
Cardiopulmonary resuscitation.
Cardiopulmonary resuscitation. Yes, that is right. All right. What is cabbage? It is coronary. Start with the C, man. Coronary. Wow. I'm so proud of you all. That means if I gave you a test next week, you can pass. That sounds good.
No,
All right. So tell me, remind me, what's the
we'll
ending?
pass. We'll pass.
You will pass. What's the ending of the suffix of each of the terms that refers to X-rays? I did highlight that to you.
Gram.
Gram. Yes. So exactly. So angiogram, arteriogram, aortogram, venogram, ventricular. Yes. All of those are referring to X-rays. Okay. All right. Thank you so much, everyone, for showing up to class and for your willing participation. Keep this up and you will all most certainly do well in my exam. I'm going to wish you all a wonderful rest of the weekend. Make sure you have some fun. Even though you're in school, you can have some fun. It is going to be 4 years, so don't stop living your lives. Please continue living. Continue worshiping.
Mr. Samuel, may one patch Mike, you know why? Thank you.
Yes, I was encouraging you to continue living. Make sure you do something to have some fun. Go out with your friends. Do something with your family. If you don't have friends or family, do something with yourself. Get some hot water, soak your feet in it, put some Epsom salts. Treat yourselves. Become your best patient. You cannot plan to go and heal people if you don't learn to heal yourselves. Even as you're going through stress, I'm encouraging you all, please take very good care of yourselves, okay? Have a great evening. Bless you.
Thank you so much, Dr. Donette.
Bless you. I always love your presentation. God bless you.
Okay, bye-bye.
Bye.
Bye. Thank you.